Hi, my name is Brittany. I'm a student physical therapist, and today we're doing a video on analyzing a wound. So first things first, when you're analyzing a wound, is you want to make sure that you have gloves on. You want to follow the clean technique. I, however, am in the middle of moving, and it does not appear that my gloves have made it yet in the box. So please bear with me. I do have on gloves in my mind. If you have your patient come in, you're seeing the wound, and you notice that they have a circular wound over their medial malleolus on their left leg. So you're looking at it, and you can go ahead and check for some pulses. You're looking at your posterior tib pulse, and you're looking at your dorsalis pedis pulse. You can go ahead and compare that bilaterally, just to go ahead and make sure. We had a 2+ pulse, which is good. It means we have some good blood flow going down there. We can also go ahead and check for the temperature around the wound, and we want to use the back of our hand when we do that. We're checking the foot to make sure that we have good blood flow to the foot. If it's a cold, that means we don't have good blood flow, which means that we are going to have some trouble in the healing process. And we're also checking for warmth around the wound. If it's warm, that's a sign of infection, which we don't want that either. And we can go up the leg and make sure that it's all the same temperature all the way down. You can also compare bilaterally if you need to make sure that the other leg also has good blood flow. So you notice that your patient has the circular wound on the medial malleolus of the left leg, and you can also go ahead and look at the skin around it. It's not dry or callous skin. It's good moisturized skin, and it's not frail skin either. Looks like good strong skin. We can go ahead and look at the wound edges of our wound. So we saw that the skin around the peri-wound skin is good, and the wound edges, we have some pink edges here. Might be a little hard to see in the video, but we do have pink edges. We don't have any undermining, and we do have distinct attached edges, which is good. We also have 50% red, 50% yellow in our wound. The yellow is some slough in there that we have from the recovery that we had going on, and the red is a good sign because that means we have a good amount of blood coming to the wound. We can also go ahead and look at the drainage. There's no excessive drainage besides the slough that we have going on, so that's good too. We can waft for odor, which is a sign of infection as well, which there was no odor when we wafted, so that's good. So far we have no signs of infection. We can also go ahead and measure the size. So we have our tape measure down here, and we are going to measure from head to toe of the wound, so from tip to tip. We are looking at 4 centimeters long by 3.8 centimeters wide. You also want to go ahead and check depth in the deepest part of the wound, which this one is about 0.5 centimeters deep. So yeah, we've checked for infection, we've checked color, we've found the location, we've wafted, there was no odor, we looked at the characteristics, and that is what you need to do. And we've also measured the size, and that's what you need to do besides pulses and temperature when you are checking for a wound.